Heart disease is the #1 killer of women. In fact, it kills more women each year than the next 4 causes of death combined. And this month, as you know, is dedicated to bringing awareness to the issue. So joining us today is Dr. David Palmer from Fort Wayne Cardiology. Thank you so much for being the expert in-house today for us.
You're welcome, Heather.
Why is this a big deal for women? We've been talking about it all month.
Well, heart disease in women is a huge problem and very much underappreciated. As your graphic pointed out, it's actually a more common killer of women than the next 4 things combined, and that includes breast cancer, lung cancer, emphysema, and stroke. And you think all 4 of those combined, heart disease is a greater problem. And the other problem is that it's very much underappreciated. Only half of women understand that heart disease is their most likely killer. It's also a little bit underappreciated amongst physicians. We're taught that heart disease is less prevalent in women, and that's true in the younger ages, but as you pass age 55, 60, it catches up very quickly. 500,000 women die in the United States every year from heart disease. That's 1 out of 3 women.
That's a huge number.
Which is huge.
Let's take a look at some of the risk factors. We have a graphic for that. And I want you to talk about these. High blood pressure, smoking, high cholesterol, being overweight. Why are those such a big problem?
Well, those 5 are the big 5 plus family history. And we'll start at the top. High blood pressure. 35 million women in America have high blood pressure. Many of them don't know it, and even when they do know it, it's undertreated or ignored, and it leads to damage to the heart, risk of strokes, damage to the kidneys. Diabetes, 1/3 of diabetic women in the country are unaware of their condition, and diabetic women have the same risk of a heart attack as a woman who's already had a heart attack.
You talked about family history. There's nothing, of course, that a woman can do to change that, but most of those factors, the risk factors we talked about, are changeable through lifestyle
Correct.
factors.
Modifiable risk factors are what you want to go for, and cholesterol is the 3rd one. 2/3 of women with high cholesterol are unaware of it. So you've got blood pressure, cholesterol, diabetes, and the only way to know is to go to your doctor and find out. These are not things that you're going to be aware of because they don't have symptoms, which is why they're so dangerous. They persist for years and go unrecognized.
And those things are controllable. As we saw there on the screen, we're talking about just making some simple lifestyle changes in the way you eat, in how often or how regularly you exercise. Those
Absolutely.
help.
Maintaining an ideal body weight, that would be a BMI of 25 or less. You can go to the web and search for a BMI calculator, find out what yours is. Eating healthy. 1 alcoholic beverage a day is considered healthy for women. More is excessive. And those things early in life tend to prevent the problems we've already discussed. Cholesterol, diabetes, high blood pressure. Once those problems have developed, then those simple lifestyle modifications are no longer sufficient, and you really need to be in the care of a physician so that you don't let those risk factors then lead to heart disease, which can be deadly.
So quickly, the takeaway message really is for women in their 20s and 30s and 40s to start doing some of these things now.
Absolutely.
Yeah. Okay, Dr. David Palmer with Fort Wayne Cardiology. We appreciate that.